Hi everyone, my name's Seb Kirby and today I'm going to be doing a brief preliminary run through of my critical analysis. I'll be analysing the Northern Territory Alcohol Mandatory Treatment Act 2013 and what current and potential effects this strategy will have on First Nations peoples within the Northern Territory. The Alcohol Mandatory Treatment Act came into effect in July 2013 and was a piece of legislation that stipulated the handling of individuals who had come under police custody due to public intoxication. The law stipulates that for an individual who had fallen under police protective custody due to public intoxication 3 or more times within a 2-month period, that person would be referred for assessment and treatment under alcohol mandatory treatment provisions. This meant an assessment by a senior clinician, followed by a hearing by the AT2 tribunal, which consists of a lawyer, health practitioner, and community member. The tribunal then decides on a course of treatment with options for a residential treatment order of up to 3 months, a community treatment order of up to 3 months, or an income management order of up to 12 months. Additionally, if a crime is committed while under the influence of alcohol, offenders are not referred through the AMT program and are instead referred through the local court system to face criminal charges. There are similar laws to this in other states, including the Severe Substance Dependence Treatment Act in 2010 in Victoria and the Drug and Alcohol Treatment Act 2007 in New South Wales. Now, many groups were opposed to the introduction of this law when it was initially proposed in April 2013. The National Australian Aboriginal Justice Agency came out swinging, stating that the bill would criminalise alcoholism, was discriminatory towards Australia's First Nations peoples, and had a poor evidence base. In addition, NAJA highlighted how the bill would place increased pressure on legal and health services that were getting by on already stretched resources.
I fail to see how it can possibly have any long-term effects as long as there is no attention being paid to changing the drivers of drinking.
Lee Nixon has been a doctor for 3 decades, including 20 years as an addictive medicine specialist. He agreed to help set up the mandatory rehab program to make sure it was done properly. But now he's packing his bags in protest and heading home to New Zealand.
It was pushed through to begin on the 1st of July as the government wanted, and that meant that any sense of carefully planning assessment for it was abandoned.
Since the introduction of the bill in 2013, there have been some small amendments to the legislation. However, the evidence to support the scheme is still lacking. Fiona Lander, writing for the Medical Journal of Australia, highlighted the limited evidence available to support the use of civil commitment processes in the treatment of alcohol dependence. Lander explained that expert consensus from the WHO supports civil commitment of only short periods in cases of emergency for the management of alcohol and drug dependence. Importantly, she highlighted the statement from the United Nations Office on Drugs and Crime, which outlined that this approach was expensive, not cost-effective, and neither benefits the individual nor the community. It does not constitute an alternative to incarceration because it is a form of incarceration. With sufficient voluntary treatment resources, appropriate referral for treatment from the criminal justice system, and community mobilisation, the residual need to use this form of compulsory or involuntary treatment should decrease until it is not used anymore at all. Lander et al. Also pointed out a number of specific issues relating to the Northern Territory AMT Act, including a lack of evaluative mechanisms, medicalisation of a social problem, poor transparency, and importantly, the potential for discriminatory application of the scheme to Aboriginal people. They explain how high rates of homelessness amongst Indigenous Australians in the Territory, combined with the high rates of alcohol use amongst homeless and itinerant Aboriginal people, makes it an easy link to see how the AMT scheme is likely to result in targeting of Indigenous Australians. In 2014, the Law Society of the Northern Territory undertook a 6-month review of the AMT scheme, releasing a scathing report. The review highlighted that the Society's initial concerns regarding safeguards on the rights of individuals, transparency, impacts on Indigenous peoples, and lack of evaluation now had firm basis in evidence. In addition, the review highlighted that the Society had reasons for deeper concern on a number of fronts. Particularly, the review was explicit in the scheme's targeting of Aboriginal and Torres Strait Islander people. It explained that 99% of individuals assessed under the AMT scheme up until that point were Indigenous, with most of these people having underlying health issues and low literacy and numeracy capabilities. The review was explicit in stating that this was a strategy that targeted vulnerable people, people that are so unwell that they have very little insight into their illness and require treatment that they will not or cannot consent to. A systematic review on the effectiveness of compulsory drug treatment, published in the International Journal of Drug Policy, found very limited evidence to support any benefit in compulsory drug treatment programs. The review indicated that the majority of studies identified failed to detect any significant positive impacts on drug use or criminal recidivism over other interventions. In fact, 2 of the included studies showed negative outcomes of compulsory schemes. The final report highlighted that this lack of evidence supports the UN Joint Statement on Compulsory Drug Detention and Rehabilitation Centres, where United Nations entities call on states to close compulsory drug detention and rehab centres and implement voluntary, evidence-informed and rights-based health and social services in the community. So this has really only been an overview of a couple of the texts relating to this topic. However, I think I've conveyed how the Alcohol Mandatory Treatment Act is clearly a policy that is not based in fact or evidence. It's poorly implemented, not transparent, and has insufficient evaluative mechanisms. It's a scheme that has been criticised by many professional groups and is yet another glaring example of a policy that disproportionately affects and disadvantages Indigenous peoples in the Northern Territory and carries on a history of disempowerment and paternalism. Some have even criticised the policy for being in potential conflict with the Racial Discrimination Act. While it's easy to see this policy as another disappointment in the long road towards closing the gap in health and social outcomes between Indigenous and non-Indigenous Australians, I think it's also important that it continues to serve as a touchstone for those of us working to develop solutions that are centred around evidence and a culture of collaboration in developing Indigenous-led solutions for problems that affect Indigenous peoples.